Thank you guys for coming back. This is going to be part two with Miss Mary Beth. We're discussing today her lupus and rheumatoid arthritis. On the first part, we left off speaking about she had the ambulance come to her home, the EMS, and she's going to go ahead and start from there to pick up from where we left off. Okay, so go right ahead, Miss Mary Beth.
Okay, so yeah, so the ambulance came to my home, and um, because I had gone through the first part of a varicella vaccination and it had completely paralyzed me. So the ambulance had come to my home, and my husband was talking to the EMS team, trying to explain to them how all had transpired with me the day before and that day leading up to this paralysis. And I could hear them talking, I could see them, I just could not move or speak. And he's telling them that I had had smallpox vaccination. And so they were asking him why a smallpox vaccination when he had informed them I had not been out of the country, nothing like that. And that just didn't make sense to them why I would need a smallpox vaccination. They asked him if I had I contracted anything. He's like, no, she had to have this smallpox vaccination. So I get to the hospital. They gave me some medication regarding the paralysis, and the medication that they gave me to counteract it, it was essentially like someone was draining something out of me, and I could feel this draining sensation going from the top of my head and just going down. And once that sensation got below my mouth, I immediately screamed out, "Chicken pox! Chicken pox!" And the nurse looked at me like, "What in the world is wrong with you?" And I said, "It was a chicken pox vaccination, not smallpox." And she goes, "Oh, okay. I understand now." I thought, "Oh my
That
goodness, they're gonna kill me. They're gonna kill me."
because that's a big difference from a chicken
Yeah,
pox to a smallpox. That's a big
yeah,
difference.
yes, big difference. Big
You're like
difference.
you're going through enough as it is to have to be giving you something other than what you needed.
Exactly. Exactly.
Oh my gosh.
Mm.
Well, Miss Chrissy, you have some additional questions?
Yeah, I do want to ask Miss Mary Beth, and I thank you so much for allowing me to ask these questions.
Sure.
You said that you are able to manage your situation a lot better now than before.
Mhm.
So, can you give some tips on how you manage your day, just in case someone else is experiencing the same circumstance or, going through the same situation that you have with lupus and your arthritis?
Sure, sure. And again, first and foremost, I put my complete trust and faith in the Lord. I couldn't get through each and every day without him.
Mhm.
Physically, things that I've done myself, under leadership and guidance of the Lord and my medical team as well, changing my diet, making sure I get plenty of rest, eliminating stressors in my life, unnecessary stressors. We live in a world today where we're going to have some manner of stress factor in our lives, and a lot of it we can control. We think we can't. We think that we have to live with certain things, but we don't. And so we have to know what we can allow in our lives and what we don't have to have in our lives.
Right.
And so coming to that point in my life has been a big game changer as well.
That's good. And on now, I know you said before on a typical day you would have to get up it starts at 2 a.m. in the morning. So
Mhm.
now with you being able to have your trust in the Lord and manage it a lot better and with the reduced stress factors, do you still have to get up that early, or if you have to be at work at 8, you get up at like 6, but do you still have to prepare yourself a way ahead of time than, an average person probably get up like about 2 hours before time?
Right. So no, a lot has changed within my life since that time frame. And like I said, that was at its worst point in my life.
Hmm.
I have since done, my parents have now transitioned home to be with the Lord. So I no longer have my parents with me. My son is an adult now, so he lives on his own. He's not in my house. So I don't have, to worry about getting him up for school or anything like that. Um, just a whole different dynamic there.
Okay.
And then as far as work is concerned, I have a job where the stress factor is not there,
Mhm.
nowhere.
That's
It's
good.
just it's not there. Um, the Lord gave me a job that eliminated all of that.
Okay.
So when I have to get up to be to work, I can get up within 2 hours before I have to be at work to prepare myself to do what I need to do and then get on the road and drive to work.
Okay. And with your joint pain, like can you describe that pain? Like, is it,
So the joint pain, body pain, um, as far as the joint pain, you get stiffness with pain. And the pain starts out with, and the best way I can describe this is if you remember when you were in middle school, depending upon how old you are, how young you are, high school, when you're going through physical fitness week and you had to do the pull-ups and the sit-ups,
right,
and
yeah.
that next day you were feeling it in the tummy area and the
Uh-huh.
arms, you were sore in your arms, and when you would go to move, any kind of pressure you would put on the muscles, you would feel that pain. That's the best way I can describe the pain itself and what you feel. Stiffness, when the joints swell, it's kind of like trying to, um, if you take two balloons that have not been enlarged, they're just deflated, and you're trying to rub them together.
Hmm.
That's the stiffness that you get. You get the hesitancy in your joints moving. So if you and playing and this, thank you, Holy Spirit, thinking about playing basketball and the ball hit your hand in
Hmm.
just the wrong position and it jam your finger, and your
Hmm.
finger's not broken or anything like that. You might have just a little bit of swelling to it, but
Hmm.
it feels like it's broke
Mm.
and it's very tight to move. That's the feeling you get with the joint stiffness and pain.
Mm.
Okay.
So at that point, how do you get any comfort? Like, how long does it last on average? And
Mhm.
how do you get comfort from it? Can you control it? At that point, you just have to just weigh it out.
It is kind of a waiting game. There is no controlling it. It kind of comes on you. You cannot control it. Trying to manage your symptoms the best way you can. Managing it is just trying to reduce the frequency of the flare-ups that you have. When you have the flare-ups of the stiffness and swelling and pain, trying to manage and reduce the frequency and the body aches and soreness. But it can come whenever. There's just no
Wow.
real, there's no set time. um Kind of like broken, if you've ever broken a bone, and when winter time comes, it's like, okay, well, when it's going to be, when it's cold outside, because you feel it in that broken bone area, or when it's going to rain or storm or something, you feel it in that broken bone area.
Hmm.
Unfortunately, it's not like that. There's no gauging when this is going to happen. The only time that you could pretty much, have an idea that you might go through a flare up is if you're in a very high stressful situation. If you've got, stress factors that are extremely high going
Hmm.
on, and you're going through it for a long period of time, then that can trigger a flare up as well. Um, but it's hard to tell if you're not getting the appropriate rest. Um, that could trigger a flare up. And so it's basically maintaining your everyday self.
Right. On average, what is your on a scale of 1 to 10, what is your
Mhm.
pain level like on a daily basis?
So unfortunately, there's never a day when I'm not without pain.
Mm,
So my manageable pain level is at a 3. My manageable pain level is at a 3. And at its worst,
wow.
10.
Okay.
Mm,
Yeah,
mm,
10
mm,
at its worst is 10. There are some days where the pain is just so bad where you just you can't move.
Do you have
And
more
the only
worse
thing
days than others? Than good days?
I used to, I now have more good days than bad days.
That's good. That's good. Wow.
Are there any medications that you're on for pain management?
I do take medications. I take medication for the rheumatoid arthritis called methotrexate.
Okay.
It is in a pill form. It can be taken as an injectable form, but I
Mm,
take the pill form. I take, depending upon how bad the flare up can get, I can also be on steroids, typically prednisone, or there may be a different type of steroid that the doctor may put me on, depending upon how bad the flare up may be.
mm,
um, Anti-inflammatories, general NSAIDs that I may take over the counter, Advil, or sometimes Tylenol, but I try to stay away from taking too many medications just because of with having lupus that just triggered so many other different issues within the body. I had developed asthma, I had developed acid reflux, I had developed a issue with intestines where my food would not digest on a normal rate. It would just process so much slower.
mm,
And so just so many different things that I had experienced over the years and just trying to manage those and having to take medication. And with medication, you find where you when you start taking one medication, it's kind of like a snowball effect.
Yeah.
Then there's a side effect, and you have to have a medication for the side effect. And then, and then it just keeps going from there and from there and from there. And so before you know it, you've got, 15 different pills that you're taking when it started out because of one issue. And so just now trying to, if there's a medication that I have to be on for this particular issue, then trying to manage anything else on a holistic or natural level so that your body is not bombarded by so many other false narratives, so many other
Mm-hmm.
pills.
Mm-hmm.
right.
Okay.
Right.
And
How
what
often do you,
about,
I'm sorry. Go ahead.
no, you go ahead. You go ahead.
Thank you. How often do you have to go to the doctor and see the doctor for, the lupus and the arthritis?
So typically every 3 to 6 months.
Okay. Okay.
What about, I know because you have the arthritis and so forth, the rheumatoid arthritis, I'm pretty sure it's hard to exercise.
Mhm.
Do they think exercise might help, or they just have you not do that whatsoever?
So with the rheumatoid arthritis, exercise is encouraged because to stay active helps to keep the joints lubricated.
Mm-hmm.
But overactivity can cause a flare up with the lupus. So that's why I say it's kind of it's a conflict between the two. So you've got to stay active because of the rheumatoid arthritis, but you can't be overactive because of the lupus.
Wow.
It's a balancing act, is what you're trying to do,
Exactly,
balance
exactly.
everything together.
Mhm.
It sounds like
Wow.
it
So
could be hard to balance though.
it is difficult, and then you want to find things that will help you to be active but not overactive. And one of the things that I found and I actually liked and had liked as a child was the water.
Mm-hmm.
So that's a really good activity and exercise,
Yeah.
and something that you can do that helps with joints, but it's not over strenuous, and you can get the exercise that you need without overexerting yourself.
Right.
Good.
Yep. And it's not stressful. It
Right.
makes you calm. So that's a
Exactly.
good.
Yeah.
Oh wow.
Well, I'm telling you, Miss Mary Beth, you have gone through so much just for the two type of issues that you're having, and
Yes.
it brings on so many other issues that you have as well. I mean, I know you said before you don't consider yourself strong, but you are a very strong lady to have to go through this. And I
Yeah.
know that God is getting you through. I
Hmm.
mean, but you also are humble as well. And you seem like you have peace, humble and peace
Yeah.
going through this process, because you would think with all the things that you told us about the situations you've been through and how the lupus is and how your flare-ups are, how your joint pain would be, it would be more like you would be a little more not forthgoing. Might be upset or anything of that nature, because you have so many issues you're dealing with. But you don't come across that way. You come across as just a humble person.
Yeah.
Now, with the illnesses that you have, do you think that God has made you that way, that you're humble, or have you always been a humble individual?
I know that God has made me that way because I have not always been a humble person. I was not a humble person. I was not a patient person, not
Most of us
in
are
any
not.
way,
Yeah.
in any way, shape, or form. Yeah, patience was not one of my virtues. And I would say that yes, these conditions have been a big factor in humbleness.
Mm-hmm. Mm-hmm.
Mm,
At
mm,
any
mm, mm.
time did you feel like giving up at any time?
There, I'll tell you, when I come home in the afternoons, once I sit down and I feel like the day is over,
Mm-hmm.
kind of, and throughout the day, I kind of feel like everything has to be held together.
Mm-hmm.
But then once I get home, then it's okay to let it all go.
That's right. That's wonderful.
Mhm.
Mm, 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 mm.
So I guess it's just keep going, just keep going, no matter what's coming at you, just keep going.
Just keep going.
It's no matter what comes, it's some of it's gonna hurt, some of it's gonna sting, some of it's, might even kind of make you stumble a little bit, but just keep going. Just keep going. Take a deep breath and keep going.
Right.
Then once you get home, then you can just breathe.
That's right. You said a lot there. Do the
Oh my goodness
steroids affect
gracious.
you anyway?
Oh my goodness, yes. The steroids do exactly what they're supposed to do. They make you put on weight.
Mm,
They will make you gain weight very quickly. Um, I do not like taking steroids. They make me crave sugar. Um, they make me crave sugar to the point where I would have cravings, like I would feel like I would need just like to spoon sugar into my mouth.
mm-hmm. Wow.
So yeah.
Wow. Yeah. So do you have to take steroids for the rest of the your life, or you think you eventually you're gonna, get off that?
I would hope to not have to take steroids ever again. It just
No.
depends upon it all depends upon how the flare up is.
Right.
Um, and the steroids are used to control the symptoms of the flare up. So, if the regular medication is not helping the flare up, then steroids come in to just help enhance the medication. So that's why managing your everyday lifestyle is key.
Right. Right.
Monitoring what you eat, just, not overindulging, and remaining active as possible, doing what you need to do to be active, but not overexerting. And again, eliminating the stressors in your life to be able to keep that peace within yourself.
Exactly. Yeah. Miss Mary Beth, you like Miss Debbie said, you don't think you're strong, but you are. I mean, a lot of people have said call just giving up, throwing the towel. You didn't. You kept going, and look at you. I mean, you don't look like you went through anything, you know?
Mm, praise
Um,
God for that.
yeah, I mean, you are a blessing. So, and I thank you for allowing this opportunity to question you about the lupus and the arthritis, because I know that it would help someone, you know, and you gave detailed information and it's very positive. And I thank you so very much. Do you have any final encouraging words to say?
Well, I thank you, ladies, for having me on and allowing me to share my story. I thank you guys for doing this. This has been an encouragement to me, what you guys are doing and sharing your stories. What you have to share with others is truly a blessing. We never know how God is going to use us. And our platforms don't have to be something that's flashy or grandstanding. We just go in the direction he would have us to go, and we never know how, what might seem small to someone else will seem great to the next person. So
True.
just keep letting the Lord use you guys and keep moving in the direction he has you to go, and you'll be amazed at how many lives you will impact. Even if you just one person, you
Mm-hmm.
know
Hmm.
it makes a difference in one person's lives.
Yes.
Maybe that was your specific purpose and you've achieved it. So,
Right.
this and what you guys are doing, I commend you and applaud you. And thank you so much for allowing me to share in it.
You're welcome. You're
Thank you.
welcome.
Thank you.
Thank you. Thank you
It's been an
very much.
honor to
Yes,
have you
ma'am.
come on this and give your interview. We greatly appreciate that. And may God continue to bless you.
You guys as well.
Thank
Bye-bye.
you.
All right.
All
Thank
Bye
you.
right.
bye.
Take care.
Take care.